Hello, my name is Erin Borgeson. I am a study abroad student from the United States who is taking the Clinical and Abnormal Psychology module at the University of Limerick. This presentation is part of my coursework for this module. Today I'm going to talk to you about panic disorder. Now, you may be asking yourself, what is panic disorder? Panic disorder is a type of anxiety disorder. Anxiety disorders are characterized by extremely high or frequent anxiety. Anxiety is an uneasiness or worry about an anticipated problem versus fear, which is a response to an immediate danger. Those with panic disorder suffer from a high level of both fear and anxiety. Panic disorder is defined as having anxiety about frequent panic attacks. The panic attacks are unrelated to the situation at hand and they are uncued, which means that they happen unexpectedly. Panic disorder can happen with or without agoraphobia, which is anxiety about being in a situation where it would be embarrassing or hard to escape if a panic attack happened. Before I dive deeper into panic disorder, it's important to truly understand what a panic attack is. A panic attack is a sudden feeling of intense anxiety, terror, and impending disaster that's accompanied by at least 4 other symptoms. Some physical symptoms include labored breathing, chest pain, and dizziness. Other symptoms are fears of going insane, losing control or dying, depersonalization, the feeling of being outside one's body, and derealization, the feeling that the world's not real. Panic attack symptoms happen very quickly and reach the peak intensity within 10 minutes. To be diagnosed with panic disorder, the panic attacks must be uncued and the person must worry about the attacks and change their behavior because of them for at least a month. The response to the panic attacks is just as important as having them in this diagnosis. In this presentation, I'll focus on a cognitive approach to panic disorder. In the cognitive model of panic disorder, panic attacks are thought to happen due to the catastrophic misinterpretation of the body's sensations. The sensations are thought to be more dangerous than they actually are. For example, someone could be experiencing labored breathing and interpret it as a sign that they won't be able to breathe and that they'll die soon. Next, we'll look at a step-by-step process of the model. This model starts with a trigger stimuli. The trigger stimuli could be external, like a loud, crowded room, but they're usually internal, such as a thought or sensation, like labored breathing. If the person thinks that the stimuli is a threat, they start to get anxious. Different bodily sensations follow the apprehension state, like chest pain and sweating. The person interprets these symptoms negatively, such as thinking that they're going insane and losing control of their body. The person then gets even more anxious, which can cause more bodily sensations, creating a vicious cycle. Those with panic disorder can have panic attacks when they are anxious before the attack, but they don't need to have increased anxiety to have a panic attack. A different emotion like anger or excitement, or an event such as standing up too quickly, can also cause the bodily sensations that are common in a panic attack. When the person attributes these sensations to something negative and catastrophic, that's when the panic attack can occur. Having increased anxiety before a panic attack can be caused by a couple of reasons. A person can be worried about having a panic attack, so when they experience a symptom that's common in panic attacks, that's what they believe the cause is. A person could also be anxious about something else, like having an argument with their friend. Then when they have the bodily sensation, they think that the cause is negative, starting the vicious cycle again. I'll now touch on some research that helps confirm what is claimed in the cognitive model of panic disorder. One study involved using sodium lactate to induce a panic attack. Heart rate and blood pressure increase when this is taken, and it was found in a study that the panic disorder patients attributed these symptoms to them having a panic attack, as opposed to the control, which fits with the cognitive model. This cognitive model has been translated into a therapy to help treat those with panic disorder. Panic control therapy is based on the tendency of those with panic disorder to overreact to their bodily sensations. In therapy, the patient is instructed to purposefully elicit the sensations associated with panic attacks. They'll eventually stop seeing these sensations as a signal of losing control and start seeing them as harmless. For example, a person whose panic attacks normally start with labored breathing would breathe rapidly in therapy to stimulate it. When they start to feel the panic attack, they would be able to learn coping tactics while they work through and eventually eliminate their panic in a safe space. Eventually, the sensations would seem more predictable and harmless. In this presentation, we defined panic disorder and went over the cognitive model that explains it. We also looked at a study confirming the cognitive model as well as a therapy based off of it. Thanks for watching!
Created using Powtoon.